This is looking at the male reproductive system. It is a combination of both exercise 42 and 43 combined together. This is a side view showing the reproductive organs of the male. As you can see, you have got in the scrotum is where the testes is located. This is where the sperm is going to be produced. And then you have the ducts known as the Ductus deferens or the Vas deferens, which is a tubule that goes from the testes. It will proceed up over the urinary bladder, around behind it, through the prostate gland, down through the penis to expel the sperm out of the body. The penis' purpose is to deliver that sperm into the female reproductive tract. There's three regions to it: the root, otherwise known as the bulb, the shaft or the body, and the glans penis. Excuse me. On this diagram, it is showing the bulb of the penis towards the back, the glans penis on the end, the root or the shaft is in the middle. The precipice or the foreskin is on the very tip of the penis. This is what is surgically removed during circumcision. This is fairly common in the United States, newborns to have circumcision done to remove the precipice, or what's often known as the foreskin. The reason behind it is that it would reduce the risk of infection, because around it, if it's left on, the epithelial cells can shed their moisture and it becomes a very warm, moist environment for bacteria to grow. There has been recently more and more controversy about it because some people feel that there is not a medical reason for doing this, that it's more just by tradition, and it does cause undue pain to the baby. It becomes basically a personal choice as to if you have a son, whether you wish to have him circumcised or not. The testes is the primary male sex organ. The function of it is to produce the sperm cells and then also to produce the male sex hormones, the testosterone. As you can see here, the testes is located in the scrotum, which is basically the sac just behind the penis. As you can see in this cross section, it is divided into different lobes or lobules. Each one contains seminiferous tubules. That is where the sperm is actually going to be initially produced. And then from there it will travel through the tubule to the retted testis and then leave the testes moving into what is known as the epididymis, of which there's different sections of that. There is the head at the top, the body, and then the tail. And then the whole time the sperm is maturing as it is moving through this entire ductwork. But it is initially formed in these seminiferous tubules in the testes. There are additional cells that are located there to help nourish those developing sperm cells, help to regulate it. And then also there are cells that are producing the male sex hormones. During development, typically the testes are going to move out of the abdominal cavity into the scrotum at about 7 months of the development of the fetus. Sometimes the testes do not completely move down out of the abdominal cavity, especially in a premature birth. With time, they'll usually watch. With time, they will eventually migrate. If they don't, surgery can be performed to move the testes down into the scrotum. If they remain in the abdominal cavity, the problem is the individual could become sterile. For normal sperm development, the internal body temperature of 37 degrees Celsius is too high. And so that's why the testes are in the scrotum outside the main abdominal pelvic cavity, is because it's a little bit cooler temperature that allows for the normal development. Once again, you can see here the seminiferous tubules. See how they are in each of the lobules, and then they all congregate at the retic testis, and from there we'll move into the efferent ductile up at the head of the epididymis. Epididymis is the structure. It looks like a cup around the testes. The function there is to store the sperm. The sperm is still maturing. It's passing nutrients to it. As they continue to move through this high network of tubules, they will eventually gain the ability to swim. So you can see how it tends to wrap around the upper portion, the backside of the testes, still in the scrotum area. And then it will connect to the ductus deferens or vas deferens, which then runs up into the pelvic cavity. The function of this is to transport the sperm during ejaculation. And if you look here, you can see how the ductus deferens, or sometimes called the vas deferens, does extend up the scrotum. It will cross over the pubic bone, cross on top of the urinary bladder, and around to the back side of the bladder. Keep in mind, obviously, there are two testes. So from this view, you can see from each one, there's a separate vas deferens. Now, the spermatic cords are helping to secure the testes, hold them in place. They have to pass along the abdominal wall. There's some weakness that can be associated with this. And then sometimes in a inguinal hernia, what happens is when a hernia is when a portion of something moves into a location where it's not supposed to be, and you get a bulging. And in this case, part of the small intestines can protrude or move into that canal and move down into the scrotum. There would be a bulging there. It would need to be corrected by surgery to move the small intestines back into place and try to strengthen around that canal to prevent it from happening again. The vas deferens essentially becomes the ejaculatory duct. It's going to pass through the prostate gland. Once again, the function is to transport those sperm during ejaculation. And as you can see here, that ejaculatory duct is indeed passing through the prostate gland. Now the urethra is going to converge with the ejaculatory duct and then form the main urethra from that portion on. There's three regions of the urethra: the prostatic urethra, as the name implies, that is where it is passing through the prostate gland; the membranous urethra; and then the spongy or penile urethra, the spongy urethra as it is passing through the penis. The purpose of the urethra is to allow transport of both urine and the semen, obviously at different times. So here you can see the prostatic urethra is after that ejaculatory duct has combined with it. So you can see that would be carrying the semen, the sperm, with the associated nutrient fluids with it. And then, as you can see from the urethra from the bladder, would join at this point. The accessory glands, there's three of them: the seminal vesicles, the prostate gland, and the bulbourethral or Cowper's glands. These three glands are producing the secretions that combine with the sperm to form the semen. The seminal vesicles, they are found on the posterior side of the bladder, and it joins with the ductus deferens. It is secreting most of the volume of the semen. It contains fructose, sugar, various enzymes, various fluids, and it's more alkaline based. It's going to help with the motility of the sperm and help with fertilization if it should occur. So as you can see here, the seminal vesicle is basically located between the bladder and the ampule of the ductus deferens, and you can see they join, the ductwork does join together to form then the ejaculatory duct. Below the bladder is the prostate gland. It does encircle around the urethra. It is going to secrete a slightly acidic fluid. It is going to contain enzymes that will help activate the sperm, and it will also secrete the PSA, which is the prostate-specific antigen. So as you can see here, it is below the bladder. It is surrounding the ejaculatory duct. Goes through the prostate gland, joins with the urethra, and the prostate surrounds the urethra and the ejaculatory duct. Some clinical applications. BPH, which benign prostatic hyperplasia, is non-cancerous tumor that what happens is basically you have an enlargement of the prostate, and when it enlarges, it constricts that urethra, making urinating very difficult. If there's problems with urination, that means the urine is retained in the bladder. That can lead to urinary tract infections. It can then lead also to kidney stones. So what type of treatment would be done? Well, typically you're going to do something either by medication, trying to initially reduce that tumor, or you may actually surgically remove the prostate gland. Prostate cancer also has the enlargement of the prostate. It also is going to constrict that urethra. There may not be in early stages any symptoms, and then as you start to develop symptoms, it would be things such as decreased urination, more frequent urination, but with less urine output, because the enlarged prostate is basically pinching on that urethra. If it is not detected in time, it can metastasize and cause secondary tumors in lymph nodes nearby, in the pelvic bones, and the lumbar vertebrae. One test that they will do is what is known as the PSA, that prostate-specific antigen. Typically, that number becomes elevated if an individual has prostate cancer. So ideally, if you have a PSA test done, and they often recommend for men about 50 years of age or older to start having a routine PSA test done and to monitor, and you want that number to be as low as possible. If the number is high, they would do more tests to diagnose whether it is a benign tumor or is it actually prostate cancer. And there's various treatment options that they can do, such as radiation or, once again, removal of the prostate gland. The third accessory gland is the bulbourethral, or the Cowper's gland. This is a very small gland. It's below the prostate. It is going to secrete a very thick and clear mucus that's going to drain into the spongy urethra when a man is aroused sexually. It helps to lubricate the gland's penis, and it will neutralize any of the acidic urine that may have trace amounts in the urethra. The sperm has three different parts to it. It has the head, it has the neck, and it has the tail. The tail is the flagellum. The neck is where the DNA is going to be contained in. On the tip of the head is acrosome, which contains enzymes that will help that sperm to be able to penetrate the egg during fertilization. This is one picture showing microscopically what sperm looks like, as you can easily see the flagella on it. Here's another picture. Spermatogenesis is the process of producing the sperm. This event occurs in the seminiferous tubule of the testes, as we already said. It starts usually around roughly age 14, and it will continue for the rest of a man's life. A healthy adult male typically will make every day about 400 million sperm. So unlike females, which at birth only have a set number of eggs, males will, once again, they start about age 14, but then for the rest of their life will make sperm. The process of spermatogenesis is through meiosis. There's two types of cell division, mitosis and meiosis. Meiosis only occurs in the production of the sex cell. So it only occurs in the production of the sperm, which is spermatogenesis, or in the production of the egg, which is oogenesis. And roughly from this table, what I want you to realize, if you look at that, at the top, you have the initial stem cell that's going to go through mitosis, which produces two cells. One of those will remain as a stem cell to continue the process of producing new daughter cells. The second cell will move on down, as you see, become the primary spermatocyte. It will go through meiosis, which is a two-step process, meiosis 1 and meiosis 2. We are not showing all of the steps here. The bottom line is that you will end up, from the initial one cell, you will end up with 4 sperm. In each of these, if you notice the 2N versus just the single N, that's referring to the number of chromosomes. It will have half the number of chromosomes of the original parental cell. And that's fine because if fertilization should occur, the oocyte also just has one set. So if fertilization occurs, the two nuclei will fuse together and you'll be back to 2 copies of everything. But spermatogenesis, which is that production of the sperm, the bottom line is you will end up with 4 new sperm cells.